Welcome everybody to a late night podcast. Do not be alarmed of the very sleeping song because it is very late. This is the first time we are shooting this in the night time because this guest is super busy, super talented, and because have a high energy. So we're gonna stop this song, and I'm gonna tell you guys in this podcast is gonna be a very special one because not only we are going to share the story of a person who made a traditional career into one of the most fun and sought after jobs among the younger generation. I am 100% excited, as you can see from the change of tone of energy and the caffeine addict I have right now, to talk to this person, as I know you will be too with their constant high energy. Ladies and gentlemen, my name is Vince, and for the first time in our show, we have Dr. Kayla. Yay! You can talk.
Hey, woohoo!
Okay, if you see this in YouTube, she'll be like, can I talk? Hello, okay. So, for the benefit of our listeners, can you give us a short introduction of yourself?
Sure. Hey, everyone. My name is Dr. Kayla. You can remember me as Kayla. So, I'm a dentist and I'm currently practicing in my own clinic. It's called Dr. Kayla Dental Clinic. Pretty straightforward. So, I'm really happy to be here, to be invited by Vince, and I hope to shed a bit of light on how do I become an entrepreneur in the dental field.
Okay. So before you, the listeners out there listening to this, right, just take a 10 minutes break, go search Dr. Kayla, and you'll see what I meant by high energy and wow, the fun stuff she does. But okay, let's get back to that. Welcome back after your 10 minutes scouting of Dr. Kayla.
I think it's 10 seconds.
10 seconds for us, first. So, Dr. Kayla, please tell us about your journey. How did you came from who you are right now?
Right. Okay. So I graduated in 2018. So that is before the pandemic era. So during that time, I was thinking, I'm having some free time before I actually go into the government and serve as a dental officer there. So I was thinking, why not I just make some content on social media? And there's a lot of people who wanted to know more about dentistry. Like, for example, how do we brush our teeth? Are dental whitening products safe? And is there anything about wisdom tooth or about braces that I can learn more about? But they do not know like the proper way, the proper source of information. So I was thinking, since I have the knowledge and I'm pretty into, creativity, content creation, why not transform or sort of convey the knowledge that I have in my mind into something that it can be easily understood by other people. So I started making some videos using very, very simple terms to explain really, really complicated stuff. And from there on, I actually gained some audience and people love watching them, people love learning from them. And that is sort of how I started, unintentionally started my content creator journey. So after I have worked in the government, I joined into the private dental practice. And from there on, I never give up creating contents. People always say, when you started working full time, then you'll not have time for this, not have time for that. But I think it's really a matter of priority. So as I move along the way, it's sort of become like a part of my daily routine. Like, content creation is no longer something that I have to do. It's just a part of my life. And that is sort of how we came to this day, from content creation to dentistry, and now I'm doing both, and both are a huge part of my life. So that's sort of how we get to today. Yeah.
Okay. So when you started out, like what platform were you using?
I started out from Facebook because that was 2018. So no one was using. I mean, there are people using TikTok, but not so much. So
2018.
2018, yeah.
Was it TikTok or was it Musically?
I think it was Musically. I'm not too sure about that. Okay. Yeah, but I was on Facebook because I love to watch like long form videos, and Facebook. I think Facebook and YouTube is really a great way to show like long form videos.
Those were the days, right?
Those were the days, man.
Long form.
Exactly.
All the youngsters listening, what is long form?
Yeah, and every videos are horizontal. Remember, guys, there was one time where there's horizontal videos. Yeah, so it was horizontal videos and whatnot. And I started from Facebook and basically Instagram. And of course, I cross-post to YouTube. And starting from, I think, 2019, I focus more on Instagram because the reach is simply better over there and can have a more personal touch. You can engage with your audience. They can reply
Back
to
in
your
the
stuff.
days.
Back in the days, yeah. And then I think after the pandemic era, that was when TikTok was rising because, a lot of short form videos are coming out. So from there on, I started trying out like short form videos and TikTok and Instagram Reels. So that's sort of how I go along the way. There was a time where I was a bit hesitant to transform from long form videos into short form videos, but in the end, we have to have to follow. Yeah, we have to adapt. We have to see what the audience is like and how to engage them and bring more information to them in the most engaging way. So yeah.
So was it before you converted to long form, right? Were your followers already that big? Because when I discovered you, I already seen you doing short form contents. I wasn't aware of your long form content. I didn't even know you existed until I scrolled down. Go.
Yeah, that was. You can scroll back to my YouTube channel. So I think back then, when my long form videos are doing really well, there are videos which are like they have like a few hundred Ks of views, and that's on the average. That was before, like what I said, when the trend was long form videos. I was making quite an amount of long form videos, and I would say from there on, I gained not a lot of audience, but an amount of audience that are loyal. Because the thing about short form videos is that it can be entertaining, but if it doesn't bring some form of values to you, people remember that you did something funny or said something funny, but they don't really remember you as a person. So if you want to be remembered, or I see what you're saying, like, I think what you're trying to say is, how do we make an impression? How do we let people remember us for who we are? Like when you talk about chef, you think of Gordon Ramsay, right? You talk about phones, you think about, iPhone. Who's the guy? Sorry.
Tim Cook.
Yeah, Tim Cook. So
Steve Jobs lah.
Yeah, Steve Jobs. Yeah. So when you want to talk about like photography, videography, you want people to remember, hey, Vince. So in order for people to remember who you are, first off, you have to bring value to them. And back then, I think long form videos was my way of bringing values because I'm very talkative, as you can tell. I'm trying to spam all the information that I have in my mind, to audiences. So I think with short form videos, we can do that. But of course, you have to convey the information in like maybe 30 seconds. So what I do is like I will say like the keywords in the short form videos, but I will elaborate in the captions. So in a way, I try to bring value to my audiences through whichever platform or however long the duration is of the video. So that is the way that you can actually, bring value into people's life. And by bringing value, people will value you. Wordplay.
This is a trailer already. I would play. All right, so I'm pretty sure you have some mentors or some mentees that you look up there, like to. Because when you started out, of course, you don't know what to do, so you have to look at other inspirations that come from. Can you share with us who's your inspiration?
I think my inspiration in terms of personal life or in terms of social media.
In terms of your career.
Oh, in terms of my career, okay. I think I don't know if you know this YouTuber. His name is Dr. Mike. He's actually a medical doctor in the States. So he was producing a lot of great videos, and they are all about like professional medical knowledge. And I was like, wow, this guy is like crazy. He goes on the street and then he actually gives medical information. He actually interviews people. Like it's just crazy that to see someone doing that. So I was like, maybe I can do that too. So that is sort of how what inspired me to embark on this journey, seeing someone from the professional field, not afraid of the prejudice that people have towards, medical professionals. We should stay in our clinic and not engage, not reach out to our patients. We should just wait for our patients to come to us.
Honestly, that's how it works, right?
Yeah, that's how it works. That's the sort of like the traditional way that people look at, maybe say in our field, it's medical field. So, of course, if you do that, there will be some backlash. I used to have like anonymous accounts coming in and telling me,
the keyboard warriors,
Yeah. They're like, dentists, you shouldn't be making videos. You should just stay in your clinic and shut up and wait for people to come to you. So I actually got that in my inbox. So at first I was like, am I doing something wrong? But then, after thinking about it, I believe that I believe in what I'm doing. I believe that I'm bringing values, or hopefully I am bringing values to my audiences. And there's a lot of stories that I can share with you, but just to make it short and sweet is that I believe in what I do. I believe in bringing value. So whatever sort of negative things that I get, I will receive, I'll accept it, I will reflect. If it's a constructive criticism, I'll gladly take it. For example, I'm not English educated. I actually speak Mandarin when I'm at home. So my English is not like really grammatically perfect. So there are some feedback say, hey, you shouldn't say this. Maybe you should improve your English in this method. I say, okay, that's actually constructive criticism. So I accept that. But if it's a non-constructive criticism, then I don't think we should really pay much attention to it. So all in all, back to your question, who is my inspiration? I think Dr. Mai is my inspiration. And I hope that if he can do this, then I can do this, and hopefully I can inspire more people to focus on what you're doing, believe in what you're doing, and just do it.
Okay. So my the next question is that you're a dentist, and I will say you're considered as a KOL as well. So people listening to this, KOL means key opinion leaders. So I've seen you do like other stuff as well. Like recently we just did a job. That's how I know Kayla, which is from Sketches.
Yeah.
So from there, I want to ask you, like, does a line will be drawn that like people will be blurred? Like, are you a content creator or are you a doctor, or like a dentist?
Right. Why not both? That's my question.
Yeah,
Why not both?
like were there conversations like when they come in, they don't know what to talk to you about?
You mean my patients, or like?
Let's say like a random person comes to you.
I would identify myself as a dentist because it is my full-time job. It is what I love to do. A content creator is also a part of my identity. But if you were to ask me, which one would you give up? I would choose dentistry over content creator because I love this field. I love being a dentist. I love transforming people's smile, and I love just helping them to better their oral health in general. So I would say that I am a dentist, and I'm also a content creator. And will there be people who get confused? I think it's still okay because nowadays there's a lot of people who are also content creators. Almost everyone is a content creator. When you create like a story, that's a content creator, right? It's just the amount of audiences that you're getting, and whether I wouldn't call myself and like they always like to label influencer or KOL. I think KOL is a title that people put onto you. I just put out my thoughts and whatever I want on social media, and whether you want to be influenced by it, whether you want to be led by it, it's entirely up to you. So all in all, I think I'm a dentist, but I do love content creating as well.
All right, so we will get to the content creation. We are actually in front of our time, so I'm gonna do a buffer.
Sure.
So I just want to share our story, how we met, and the first impression was, damn, this is a dentist place.
Yeah.
It's like, is this a studio or a dentist? Because let's be honest, on that. I'm not sure she's listening to this or not. But when we shot every single person, like few different KOLs, right? Like working KOLs, you were the only one that had everything set up there, lighting perfect. We don't need to do a lot of works.
Right.
And then it was like, was it like when you go there, like was it in your conscious thought, like, okay, I want to build a dentist and I want to have like a studio built into my clinic?
Yeah, I do have some, photography equipments with me because the thing about dentistry, if you notice, we want to level up. See, when you create a beautiful smile, you don't take pictures, you don't take videos. The patient can't really tell, sometimes, but when you take pictures, when you take videos, you document a part of that process. And it actually helps, in terms, like in professional terms, it actually help us to evaluate, help us to monitor our treatment progress and make sure that everything is on track and everything is according to what patient wants. But in another way, it is also a way to document their journey. If you're looking at other countries, I always love to learn from people from other countries, what they're doing. They're doing way more than us, When you're looking at, everyone is doing like drone now, but it has already been started in maybe the States like many, many years ago. So I believe that in order to improve, we have to look ahead in the future. So when I'm looking at what other dentists are doing in other countries, they are already documenting before the patient start and 2 years later, and when the patient smile, you can see all the changes. So I was like, yeah, I want to do that. And I sort of have the knowledge, the basic knowledge about videography and photography, lighting and everything. I gained it when I was starting out as a content creator. So why not integrate both knowledge together? And when people look at the video, they'll be like, wow, okay, I didn't know that dentistry can be presented in such a way. I didn't know that you can document a process in such a way. So we always want to look for that wow factor. So how do we do the wow factor? Not being afraid to be different, not being afraid to invest in whatever we think that is important. Although, if people come to my clinic, they'll be, oh, why do you need this? Why do you need this?
Yeah, that's the question. Patient ask, why do you have a big ass lens pointed directly at my mouth?
Exactly. So it's actually a part of the normal routine. If you were to visit any other dental, famous dentists in other countries, documentation is a really basic part of their treatment. It helps us, like what I said, help us to analyze the case, help us to keep track of the case. But not much people are doing that maybe for now here in Malaysia because of lack of awareness. I believe that in order to learn more, we have to be aware of what we do not know. And when we realize that, then we can level up. Yeah.
Do the patients have to sign something? Hey, I'm going to be recording you.
They have a consent form.
Okay, alright. So that's because overseas is different but in Malaysia people would be like, why are you shooting me? What's this?
I think Asians are more but
conservative I would say.
Yeah. But it really depends because when you really help them, you really help them to transform their smile, they're actually more than happy to share because they are really happy about their result and they don't mind it.
Okay. Yeah. So do you have a team under you in terms of planning your content out and posting, editing, releasing it out?
So I do outsource some of my productions to my editors and my videographers because it's impossible to do it all yourself.
Yeah, that's why it's tight schedule and well.
True. Especially when you're a full-time professional. For example, like what I mentioned, back then I was more free, so I do everything myself. I set up a tripod, put a camera just like that, and then I actually talk into the camera. I check my own footage, so that's how I do it. And I actually scripted everything myself as well. I even edited myself. I learned how to use Premiere Pro from YouTube. Yeah, and then I learned how to reduce
YouTube. Okay.
Yeah, I learned how to Premiere Pro from YouTube. I learned how to do all those effects, masking and whatnot.
Wow.
Yeah, if you put in a time, it's actually not too hard. But the learning curve is really steep. Yeah, and then
we can throw our diplomas away.
No lah. It's different because I've learned through errors. I have to learn through the mistakes that I've made. There are some shootings where I did maybe 1 hour of just a 5-minute footage, and I realized it's all blurred.
Oh my god!
So I have to redo it again, and then one line of my script, I might repeat it for 30 times just to get one sentence perfect because I'm a perfectionist. So that's sort of how we learn along the way and how we improve in terms of the production. Sorry, what was the question again?
Do you have a team?
All right, yeah.
So earlier she said she might talk a lot.
Yeah, I always do that. I always venture away from the subject. But anyways, do I have a team? Yes. So now I have my own editor, my content editor, and I still plan my content. I still script my content myself because I want to be authentic. Yeah, but it's always nice to have a helper to help you, when you don't have time to do all the editing. And plus, he does a better job than me. So
what about those TikTok reels though? Because that doesn't feel like it's curated or doesn't feel like it's scripted. It feels like I have an idea. Okay, you all sit there. Because I remember there's one video you did with your nurse, the appointment or something.
Yeah.
I was like, I don't think that's scripted. That's like, okay, it's from your experience, I would say lah.
Right.
Was it great?
It's some sort in a way like when I'm scrolling through reels or scrolling through TikTok, I was like, oh, actually this happened before. Why not I transform this into like my whatever I encountered in my daily dental life. So all the TikTok, all the reels are created by myself. So it was like, okay, I have this idea. Okay, let's execute it. So it's just like that. Yeah, not much scripting going on there.
Is your stuff is Dr. Kayla again? She's with your phone.
Nah,
oh my
it's okay
god.
They are used to it already.
do you put that in their class? Okay, must be
No
TikTok
lah.
talent.
But nowadays I think everyone is into it lah, so they are quite okay with it.
Okay.
Yeah.
So the next question I want to ask you is how do you balance between creating content and focusing on running your business?
Right.
Because I know that those two are equally important for having a successful business coming?
Yeah, but I would say like it's a matter of choice, like what I've mentioned. So back then I used to struggle a lot. Even now I'm still struggling on how to run a business. For me, it was a little bit easier because I've been creating content since 2018. So it has been about 4 years now. So 4 years to me, it really is, you know yourself, you know what your audience is like, and then you know what sort of things that they want to watch. So content creation is not so much of a challenge right now. The challenge, however, is running a business. And how do I find time? I don't have off days. So even on my off days, like sometimes I give myself a break Sunday. So I was sitting at home and I was like, no, I'm not gonna do this. I have to go to the clinic and I have to shoot more contents while I'm still free. So basically, you have not much of a personal time and not much of a free time.
But do you see it as a must thing, or it's like a I want to kind of thing?
It's a bit of both. Yeah, you know, sometimes it's really tiring to create content. You know, after a long day of work, you talk to so many people, you're mentally exhausted. But you look at your Instagram, it is time to post a reel.
Oh my god.
Oh my god. Yeah, and then it's I would say that, you know, creativity, we talk about content creation, a lot of people think, oh, it's something creative, or it has to be like inspiration. Yeah, but a lot of time it's not like that. It's planned. It's you have to follow a schedule, you have to be disciplined. So today I realized that, okay, I haven't been posting in a long time, I must post something today. So immediately I have to sit down, I have to look through, and then I have to think, okay, and I'm going to talk about this, and then you have to immediately film it, and then you have to write the captions, and then you have to post it. So it's a bit of a discipline thing as well. So that's why a lot of people, when they started out, they're like, oh, okay, I can do this, but after like 1-2 weeks, you're like, oh, I'm too tired for this, because it is not planned. It should always be planned. Everything is always planned. Yeah, especially in content creation.
But it also helps if you see a results in some way. But
yeah, but honestly, results, like a lot of people think, okay, I'm going to produce 10 videos and I'm not going to expect 8 of them to go viral. But it doesn't work that way. Yeah.
It's a very high expectation.
Yeah, but and when you realize that when I'm making 10 videos and none of them are working, then I feel very demotivated. I feel like I'm not happy about content creation anymore. But you have to believe in, like what I say, the value that you put in terms of content creation. For example, today I produce 10. Okay, this month I produced 10 videos. 10 videos, I only have 20 people watching. Okay, so each video I have 20 views. But if in that video, in those 20 viewers, 2 of them told me in the comment that they learned something new, that they enjoy watching the video, that they you know, it gives them some new knowledge. So you're bringing value into those 2 people's life, and that makes a difference. That's to me. Of course, when something goes viral or when your content gets a lot of attention or audiences, it gives you a lot more, you know, that reward, that sort of adrenaline rush. But in the end of the day, it's not the attention that you're looking for in content creation. It's about bringing value into people's life, no matter it's 2% or 20, 100, 20,000 person. So it's really
as long as you break through that 1% is enough.
Yeah. So another interesting story, so I want to share with you because a lot of people don't know about this, is that, okay, so back then there was something called fake veneer. Basically, it's a procedure, like feeling like it's an aesthetic procedure where
we're getting to the medical part of this podcast.
Yeah. So there are people who are not dentists or dental professionals. They go to people's house or they invite them to hotels, and then they place in like a tooth filling material onto the surface of their teeth to improve the appearance. So that's actually really dangerous because first thing, there might be disease spreading. Second thing, it might actually bring harm to the teeth and to the gums. So a lot of people didn't know about that. So I actually made a video together with the Malaysia Dental Association, and we sort of want to raise awareness in combating this issue. So you know, when we make videos, it's not about, you know, getting attention. It's about bringing awareness to the people. We can't control people who are doing that, but we can control the people who are going to them and getting the treatment. And when they have the awareness, they will actually make changes. So what happened was that I released that video, and a few months later, when I was at a dental conference, it's like a sort of like a big meeting. So a dentist from Penang, I don't know that guy, so he came up to me and he was like, "Hey Kayla, thank you for making this video, because one of my patients actually watched your video and she decided to come to my clinic and get her fake veneers removed." So so it was.
Was it a legal thing?
It was to get a dental procedure done by a non-dental professional is actually illegal. But however, if you've gotten it done, you can actually get it removed. by a dental professional. So it was that moment when I realized that, wow, I made this video. I didn't know someone from Penang is going to watch this video and is going to go to a dentist and get it removed. Although I've never met that person in real life, or maybe I'll never meet them in real life, but I did something that has inspired them to actually take action. And that is like the value that I see in the content that I'm putting out. So you have to believe, when you're making content, you have to believe that you're bringing value to people. And when you bring value to people, as what I mentioned, people will value you and they will help you to grow.
Just want to add up the value part as well. Recently also I've came across the same thing as well. Like when I did a video, so when I bought a property back in Rawang, have you heard of the upfront deposit payment and all?
Yeah, I'm not too
Like
familiar.
whenever you buy something, right, a property, right, you have to pay like a deposit fee.
Right.
So usually they say, oh, they will potong from the SPA, they will potong it from like some charges lah. Then they say it's refundable if let's say your loan is rejected.
Okay.
But actually, do you know that it's actually illegal to ask for upfront payment or to pay any payment? It's for everybody listening, to pay any payment way before you sign the SPA. So because that story came about when I checked back my receipts. As I remember, hey, I paid $1,000. They haven't returned me. Then I asked the agent, what did you do with it? Oh, he said, oh, he paid for this. Okay, show me the receipts to prove. He never show blue tick. So I actually made a video about this. Then I actually did research. Is it legal or illegal? What to do? What happens? So I just did a random video. Hey guys, do you know one real estate scam that most people do but they don't know, which is collecting the upfront payment or deposits lah. And it's okay if they return it or if they compensate it in putting into the SPA is fine. But if they don't do anything, it's actually illegal and you can actually complain it. And that video blew up.
Wow.
And I've seen a lot of people sharing their same experience as well.
Right.
I'm like, bro. That's one until now. He paid like 7K.
Wow.
And the loan got rejected.
Oh.
But he wasn't returned the 7K. Only returned a few hundred only.
Oh no.
They say, oh, it's management fee. This. I was like,
because we are not in that field, so we are not aware of that.
yeah. And I was like, wow, okay, cool. It's so it blew up that well. It went to a developer.
Oh.
So okay, we are a real estate based creative production agency. So
Right.
we usually shoot real estate stuff lah. When we're shooting one, there's one of the developers came. You look so familiar. I'm like, I
You
think
guys worked together before?
maybe yeah. It's like no. It's like, hey, are you the guy from TikTok? I was like, huh? Then he showed me, oh yeah, it's me. And then I took off my mask. Yeah, it's me.
So people recognize you through your eyes.
Yeah. Then he was like, oh, he said, oh, it's actually yes and no lah. If they return, then he explained to me what is the process. Then I was like,
So did you make another follow-up TikTok video?
I wanted to do that, but I have, like you said, discipline. I have other videos to stack up.
Right,
So I'm just gonna maybe do it in a few days later lah.
Right. And you never do it. That's how it will usually work. Yeah, you have to
but
do it
yeah,
right
but
away.
the thing is, I reply everybody in the comment.
Oh, so kind of.
Then I was like, there's one person until now asked me, bro, how old are you? You know all this stuff, man. And then I was like, Google the actual name of the
Right.
what's it called, the legal terms of it, then just paste it, you go search yourself. And then everybody else came in to support me. I was like, oh,
there's always this one skeptical person who, but it's okay, yeah.
yeah, all right. So I want to ask you about in terms of the business business part of it, then we go to a little bit medical of it.
Sure.
So because most of our audience listen in terms of the business.
Oh,
So
I
what actually goes on in running a dentist clinic? What do you need to be aware of? If let's say budding dentists are listening to this, they want to start a clinic, what should they be aware of?
I think the amount of back-end work that we have is enormous, and a lot of people don't realize. Even I don't realize that until I, started my own practice. I realized, hey, in order to get a filling done, I have to buy this. I have to buy the equipment. I have to buy the material. I have to make sure that I have enough nurses working that day. I have to make sure that I have enough doctors working that day. And how is the sterilization, the cleaning?
Oh, do you have
protocol.
doctors under your clinic as well?
Yeah, we have a few actually.
Oh, I thought it's just you only.
Oh no, I can't work alone.
Okay,
I like to work in the big team, so that's how we actually support each other. But yeah, there's a lot of back-end work behind a seemingly simple procedure. So I think a lot of people do not realize that. They do not understand the effort being put in behind a simple procedure. For example, how do we clean the dental chair? How do we sterilize our equipment? How do we make sure that everything is done according to protocol? The doctors has to be good, the nurses have to be good, and everything has to have a system. So the back end work that we really have is something that can be learned through experience, and of course through a need to improve yourself. And it's not just for dentists, actually, it's for all sort of segments. For example, you got your production, then you started thinking, hey, I should start a podcast since I have all my equipments in, and hey, I should now start to buy this, buy that, buy this, buy that. And as you level up, you realize there's a lot of things that can be improved. So we have to have that sense of improvement. And I understand, behind the production, you see a 3 minutes video, you don't understand the amount of editing that you go behind, the lighting. The client asks you, what for? You want to buy so many things just for one dish footage? They don't know about the lighting. They don't know about the sound recording. They don't know whether the talent is talented.
This is what we call a perfect client, guys.
Yeah.
What
because
when
you go through that, then only they realize that, okay, this production needs this to
to
work.
make it that perfect video.
Yeah, to make it that perfect video. They can't just bring a camera in, bokeh, put F2. The bokeh very nice.
She knows the word,
But there are not good lighting, the light very harsh. The people don't understand what's going on behind that. So it's the same for dentistry. It's the same for any other fields. Yeah.
So what about your nurses though? Do you when you hire them, do you have to train them, or they already have that pre-qualified knowledge of it?
Some of my nurses have they have experience before as an dental nurse, and some of them they do not. So it's good because we can train them in the way that we like to work. For example, different doctors, we have different personalities and different way of working. So we want to make sure that we train them in a way that it achieves a certain standard in our clinic. So yeah, we do train them ourselves.
Okay. So I want to ask you the next question is like, do you think dentists right now should be taking social media a serious form of marketing funnel in their business?
I think from my personal experience, I think it does help. However, I don't think it's the sole source of marketing. Yeah.
What kind of other marketing there is though for a dentist? I'm really curious.
The best marketing is word of mouth.
The
best marketing is word of mouth. For example, most of my patients don't actually, of course, a lot of them come from social media, but a lot of them actually come from word of mouth. For example, you go and get the scaling done. The dentist explain really well to you, really detailed to you. They care about not just your teeth. They care about you as a person. What's your hobby? What's your career? Why are you grinding so much? Are you having a lot of stress? What can I do to help you with that? What's the long-term solution? So when you care about a patient as a whole, they will want to bring the people that they love to your clinic as well, because they want them to be cared in the same way. So when you treat someone, like for example, when I treat my patient, I treat them with genuine heart. If I think there is a case that I don't think is within my expertise, I'll just refer them, say, I don't want to waste your time. This is not fair for you if I were to do this for you, and might as well I just refer you to a specialist. So when you do work well, and for example, I'm doing a lot of aesthetic dentistry. So when patients flash that beautiful smile, their friends will ask them, hey, your smile is so nice. Where did you get your teeth done? They say, oh, okay, at this. So they will actually go to the dentist, because most of my patients, they say, oh, I saw my friend, she did this. It was very nice. I wanted to get that as well. So word of mouth, although it takes a lot of effort and a lot of time to build that foundation, but once it has been built, it will not crumble that fast. When you do marketing, you throw in, from what I understand from my friends who are doing marketing, they throw in money to buy ads.
Yep.
And then
run ads, marketing agency to help them do stuff.
So of course it's a good way if you are starting out and you don't have any experience in doing so. But there is I would say there is a limitation. So for me personally, it's great when you're a content creator, but my main source of, say, marketing is still producing quality work, and let that be my foundation. And it does take years to build as compared to social media. When you put on a piece of video, it blew up, then it's different. I would say it's different for medical professionals like dentistry, because in the end of the day, it's your clinical skills that matters. But when you are a production, you create a piece of beautiful video and it blew up. And I'm sure there's a lot of clients who will find you to make videos. So I guess it's a bit different for different industry. Yeah.
All right. So, but I'm just curious though, like, let's say, because naturally you are a very outspoken person, and what if like other dentists, because okay, let's be honest lah, the most doctors I see like, okay, The very quiet one. It's like sometimes they
yeah.
don't dare to
Yeah.
speak because maybe they're introvert or something.
True.
What do you think about those entities? What should they be doing?
So, not everyone is born an extrovert. There used to be a time where before a radio interview, I was so nervous. I was like reading up. Yeah. But as the more that you do, the more that you know experience, and the more well spoken you get, I would say. And a lot of people say being on social media, being a content creator is trying to make yourself like you have to act like you're this person. But actually, I don't think so. I think content creation is simply knowing what is your favorite personality of yourself and enhancing that personality. For example, who's that guy who
Ben?
always do like this the that Africa guy which are like they're showing their hand.
Kevy.
Yeah.
Yeah, he
So
don't speak.
yeah, he don't speak. All he does is like showing his hand outside. It's like, you don't see this. You
By the
don't
way,
see
he's
this?
the number one biggest follower count in TikTok.
Yeah,
And he
yeah.
don't speak.
Yeah, he only shows both of his palms.
Yes.
And that's it. See, if you're an introvert, can you do this? You
Yeah.
can do this. Yeah, everyone can do that. Everyone can show the palm of their hand, but it's the creativity, is the humor that you have in it. Whatever personality you have, be it introvert, extrovert, or whatever, but lah. So you can use that personality and make it into something that people will actually like. People will engage with, people will interact with it. So I wouldn't say that you have to be an extrovert to be a content creator or to start, but you can take your best personality and enhance it. The trick, however, is to find a creative way in doing so.
All right. So hope the listeners are listening to this. Hope you guys are getting something out from Dr. Kayla today, and how you can see that how dental clinics run and how the business is going. So let's go into a little bit medical, because we do have some few last questions left before we end the podcast. A little bit medical side. So it's a very quick question, yes or no kind of thing. So this is what I see in TikTok is it does whitening your teeth is a bad thing for your teeth, because naturally teeth are supposed to be in a different color or something like yellowish.
True.
Is it bad or good?
There is a limitation in teeth whitening. There are only a certain shade that we can achieve. So, and it really depends on why do you need a teeth whitening. For example, a lot of people, they get teeth whitening because their teeth are black or their teeth are yellowish. But sometimes the reason that your teeth are colored in such a way is not because you're drinking a lot of coffee. It might be due to a decay. Yeah, so how many times you do whitening, it wouldn't really help with that condition. So there is a limitation in terms of the whitening outcome. Most importantly, you find out why do you need whitening, why do you have color, this kind of discoloration, and get the proper treatment done. And does whitening harms your teeth? Not really, because they don't really damage any structure. However, they break down the colored particles in your teeth called chromosomes. I know it's starting to sound a bit scientific, but basically...
I'm just trying to remember all my biology.
Yeah, but basically, when you have stains, okay, so whitening basically release oxygen bubbles. Okay, not bubbles lah, but we call oxidation. So it basically release oxygen that break down these stain particles. When the stain particles are gone, your teeth will look whiter. So that's how it works. I hope I'm not speaking alien language.
I understand some language lah. My biology teacher is like looking at me. Is like, you better understand. I teach you so much. Yeah. Okay, so next thing, does eating ice rottens your teeth or damages your teeth?
It doesn't rotten your teeth because it doesn't cause tooth decay. However, it can crack your teeth. It's actually one of the main reason a lot of people have cracked tooth, because when you are putting your teeth in such a huge pressure every day, it's gonna break at some point. Yeah, so that's just wear and tear.
Oh, okay. So is it like memang cannot do, or it's like depends on the teeth power or
We
something?
don't recommend that. It's like every time you cross the bumper when you're driving your car, you never slow down. Will it damage your car? Not really, but will it damage in the future? Over a long time, it will. So it's sort of like the same way.
All right.
So this is a challenge in trying to put a really scientific thing into something that a lot of people can understand. Like, when you describe
Common thing, right? Like
common
people can
things,
understand.
then they're like, oh, okay, macam makes sense.
Okay, so next question is,
Right.
does brushing your teeth every day or before bed really matters or really affects.
Right. So you should brush your teeth twice per day, once in the morning and once at night. And after you brush your teeth at night, do not eat anymore, because whatever food that you're gonna eat is gonna stay in your mouth for the entire night, and the bacteria is gonna feast on it. Yeah. So twice per day with a soft bristled toothbrush and a fluoridated toothpaste.
Okay. So that's the follow-up question I want to ask.
Yeah.
Does toothpaste matters?
Toothpaste does matter. A lot of people will ask me if whitening toothpaste or charcoal toothpaste work. So we usually recommend toothpaste with fluoride. Fluoride is a type of mineral that will strengthen the outermost layer of our teeth called enamel. Charcoal toothpaste, personally, I wouldn't really recommend because it's what we call abrasive. So how does it work? Of course, it works in whitening your teeth, but how does it work? When your teeth get stained, charcoal comes in, it actually wears off the outer layer of your teeth. So imagine it as you're using a sandpaper and you are like sort of like smoothing the tree, the bark of a tree. So of course it will look smoothened, but you're actually wearing it down. But our teeth is something that is, it's not supposed to be worn down. When you brush with charcoal every day, you're actually thinning down the protective layer of your teeth. And over time, you will be, you might have the chance to develop tooth sensitivity, or we call dentine hypersensitivity.
That makes sense.
Yeah. So, before you use a certain product, always go to your nearest dentist and get a checkup done. See whether you're suitable for that product. And if you can, bring that product along, let them take a look. That'll be the best way.
Or you can head out down to Dr. Kayla's clinic.
No need lah. Just visit your nearest dental clinic will do.
Last medical question is that what are the things that a patient or a soon-to-be patient, dentist patient, should be aware of when they come to a clinic? What should they be doing?
I think they should be aware of their medical condition. So a lot of people don't know that certain medical condition can affect your treatment. For example, if you're pregnant, then you need to let us know, because there are certain procedures that we might not be able to carry out.
How does that affect teeth?
If you're taking an X-ray, we want to avoid that in pregnant patient, or maybe we will take another form of X-ray with lower radiation dose. So it really depends on which trimester you're in, but that's a bit technical. So another thing is whether you have any history of, say, mouth breathing. So some patients, they have a nose blockage problem. So when we're doing certain procedures, they cannot breathe through their nose. They want to breathe through their mouth, but there's a lot of water inside, so they started choking, and then it becomes a very horrible experience for them, you know.
Wait, have you got spitted on?
Dude, you don't want to know, man. Don't ask questions you don't want answers to. So apart from that, I would say maybe like hypertension, diabetes, or whether you had any cancer therapy done before. So when we are able to, like what I say, treat the patient as a whole, we're better to bring a better experience for the patient. So we always say you don't treat the holes in the patient, you treat patient as a whole, because holes are decay. So wordplay number 2.
Okay, so people listening to this, you can see Dr. Kayla is very well educated and she will treat you better. Alright, so coming into the last 2 questions is that what are the things that people need to be aware of when starting a dentist clinic? Like really people you can, because some part you can see from Google, search it up, but all that comes down to the experience you have running a dentist clinic. What are the things they don't know?
You mean for like people who wanted to start a dental clinic?
Yep.
The things that they do not know, I would say, is that it's developing a system. Developing a system the moment that patients go into the door. How should your receptionist talk to them, and how should your nurse be treating them? Like for example, for my patients who come in, if they are a lady, if they're wearing short skirts or they're wearing like sleeveless, then my first thing to do is to ask them if you are cold, and you put a blanket on them. And once they are comfortable, then let's start to talk about your dental problems. So those seemingly minor stuff actually matters. I mean, at least
to show comfort, I would say.
Yeah, to ensure comfort. So, and when patients leave, when they want to throw their tissue paper, or when they need anything, are my nurses there for them? Am I here for them when I'm not around? Is there someone taking care of the patient? So all of these minor stuff is the things that matters, and that is what elevates the experience, the patient experience. So I would say that is the part which a lot of people do not know. And And that is a part where your team has to be trained as well.
Okay. So, next question is, we see you in social media. We see you always happy, fun, doing this and that. Sometimes I remember there's one story you say you're like burned out or something.
Yeah.
So, what is that people don't see behind Dr. Kayla's success?
Right. So like what I've said, what I've mentioned, I don't have much free time. So after work, it's always content planning, or it's about thinking how to make things better, make things more comfortable for the patients. And it's always brainstorming. It's a lot of meeting. It's a lot of meeting with people like you, doing podcasts, learning from this, and gaining experience. So I think the amount of time sacrifice and the amount of effort that is behind a content or behind a case is a lot. And I think that the sacrifice that you're willing to take is also equal to the reward that you're getting. So if you are sure of this direction and you're going to that way, you have to be prepared to sacrifice a lot. That means your personal time. I do remember the last time I went out and have a drink with friends. So
Oh my God.
I don't remember. Yeah, even meeting my parents or my family, it's like it's something that has to be planned.
Oh my God.
Yeah, but I'm trying to find a balance in that. That is also my weakness. It's because I put a lot of time into my career that I tend to overlook this part. But I realized that it is one of the mistakes that I've made. Yeah, so guys, mistakes that I've made in 2022 is that I have been putting too much focus on my career and then neglected my own personal health and mental health. So I'm learning to let go and to put more time into taking care of myself, because what we all know, life is not a sprint, it's a marathon.
Yep.
You have to take breaks and you have to go. That's how you can go further.
Was there a point where you decided, is this really worth it? Am I supposed to own a dentist?
Yeah, of
Can I just go back
course.
to being a doctor under a doctor?
Yeah, because it's so much easier to work for someone when you
Yeah.
don't have to care about all the back end jobs. But it's so different when you're an entrepreneur and everyone is relying on you and you have to take care of everyone. It's really, really different. But the way I look at it, I'm 28 this year. In another 4 years, if I started 4 years later, I have to go through the same thing. Why not I started it earlier? I mean, it's going to be difficult anyways. Might as well do it earlier. Yeah.
See, that's an entrepreneur's mindset.
That's the way I look at it. And there's a lot of people, like a lot of patients that I've met, they are way younger than me, but they're doing way more than me, and they never complain. And that's the important part about surrounding yourself with like-minded people. When the people that you surround yourself with they're contented with their life. Not saying that it's not good. It's good to be content with your life. But
I think some point it's just get annoying, man. It's like, stop
Yeah.
complaining, bro. Just do something.
yeah, if they are saying, oh, my boss never give me a raise, then you have to ask, are you doing enough to deserve that raise? If you think you are doing enough, can you go out and do it yourself? Can you can you put out as much sacrifice as what your boss has done? If you can, then just do it lah. Yeah. So I was thinking if other people can do it, why can't I? So in a way, like you were talking about inspiration, the people around me inspires me. When I met this patient, wow, only 20 years old, already have a huge team, doing so many things, so motivated, so much energy. I met this patient, 65 years old, still working.
Wow.
Yeah, driving a Porsche, doesn't need to work anymore, but still working. Ask them, why won't you retire? They tell me, I'm too young, doctor. 65.
Actually, that is true. It's just all about mindset.
Yes. I'm so young.
Imagine
doctor.
you live for 100 years. 65
Yeah.
is just you got 40 years left,
Exactly.
bro.
It's not about the amount of money that you're. Of course, when you're living a comfortable, you can stop anytime. But my patient told me, I think I'm still young, and I think this is what keeps me motivated. If I don't work anymore, I will feel like I'm not giving purpose in my life. So they balance the work life thing really, really well. So I'm trying to learn more from them. I'm trying to put more time to myself, but at the same time not neglect, the career sort of the career Kayla.
Sure, another 10 years.
Another 10 years.
Interview you again.
Yeah.
So, Dr. Kayla, what car did you drive in? A Tesla? Do you have a driver?
A Toyota Vios secondhand.
Do you have more time now? All right. So, last question. What's next for Dr. Kayla? What's after this? You opened the clinic.
Right.
It's a really beautiful clinic. Go check it
Thank you,
out.
thank you.
It's very pink.
It's
I was
very
struggling to color grade
Oh, I'm so
when I
sorry.
was shooting because
I know every corner is pastel tone.
and you were matching with the background.
I was blending in.
Yeah, because you wear the same color as the
Right,
background. I was like,
right.
I need to. So what's next for Dr. Kayla?
So I think it would be building a bigger team,
Mm-hmm.
building a bigger team in bringing more quality treatments to our patients. And in terms of content creation, to continue producing more and more quality content, and hopefully to have a bigger team as well. As you know, we can't go far alone. It's always
Yep.
good to have a great team, a great partners to grow together. So for me, it's about building a bigger team for both my dental clinic as well as my content creator journey.
Are you planning to open more clinics, like a franchisee brand?
Well, if we can maintain the quality, the treatment quality, why not?
Okay lah, we see another 10 years lah. We record this now. 32, is it? 10 years, yeah.
And then you throw back, hey, you remember you said this or not?
Yeah,
Come, I check whether you did it or not.
We'll be like so old. Hey, Dr. Kayla, do you remember? All right, guys. Hope you got some value from this. It's pretty late, so I don't want to take much time of Dr. Kayla.
No worries.
And hopefully you learn something from this podcast and very insightful. And as always, guys, if you have any questions regarding about business or you want us to bring any other guests, do let us know in the comment section below. And as always, guys, go out there, discover, connect, and inspire. And I'll see you guys in the next video. Ciao.